serious problem. It can cause death instantly, or you may have damage to the heart that can be correctable and survivable. And in fact, we can do things to help that. When this occurs, it's what we call a heart attack. In medical terms, it's called a coronary or myocardial infarction. Infarction is the death of tissue without the death of the body. So a piece of muscle can die without the patient dying. Many people survive. There's so much excess blood supply that it actually takes more than 70% narrowing of one of the major vessels before the patient will feel any symptoms and before you have any problem to worry about. The good side of that is we have a lot of reserve. The bad side is you may be very, very sick without knowing it. You may be on the edge of having to have your arteries replaced or bypassed or some other way of bringing blood in. And I'm going to go into that a little bit more in the next lecture. The veins are somewhat more simple. They have a very similar pattern, and they drain themselves right back directly into the atrium. There are little holes in the right atrium bringing the venous blood back into the right side of the heart for drainage. But basically, they parallel the arteries. We teach our medical students to learn all the names of the arteries, and then the veins just go along with them. Next thing we want to talk about, we've talked about the blood supply, the structure of the valves in the wall, is the conduction system of the heart. The heart is made of the muscle, as I said, which is inherently conductive. What happens in embryology is this muscle is different. It differentiates from other muscle in the body, and it further differentiates in that about 1% of this muscle becomes almost like nerves. They're not really nerves, but they are conductive. They can send electrical impulses the way a nerve can. Now, you can hear me talk about this a lot, but the nerves of the body and the muscles of the body are an electrical phenomenon. And the way they work is chemically. There are ions, which are charged chemicals, such as sodium, potassium, calcium. They all have electrical charges. And when those ions move across membranes, they can propagate an electrical charge. In the nerves, it causes stimulation of something, the brain, the muscle. And in the heart, it stimulates the heart itself. These conductive fibers are what allow us to get impulses through the heart so the myocardium can contract. Now, if you look at this next slide, remember I told you there was different inherent rhythmicity in the heart. If you just took the heart muscle down here in the ventricles, it would have a rather slow rate, probably 20, 30, 35 beats per minute. That's not good enough to keep the blood in the body going at a rate that will allow life. Fortunately, up here, the rate is even faster. And we have a pacemaker up here in the wall, high on the right atrium, called the sinoatrial node. It's a little piece of highly specialized tissue that has a rhythmicity that is fast enough for us to be able to survive. It sends its impulse back to the rest of the heart using the fibers inside the muscle. And the circulation at first is right through the wall of both atria. Now these fibers come together right here at the atrioventricular node, where, as you can see, if you look very carefully, things get very small. So these impulses get to the node and then go down through this very thin area and then to a big one again. This is like a traffic jam. It's a very purposeful traffic jam, again, that evolution has given us. The impulses will slow down, and I'll explain more of that in the physiology, but basically it is then distributed to all the sections of the ventricle and the musculature here to allow proper contraction. The ventricles are able to contract. First contraction goes through the atria to pump blood into the ventricles, and finally the ventricles to pump blood out of the heart and to the rest of the body. This is an extraordinarily sophisticated system. It has many, many things that are finely tuned to all situations, but it also has many, many things that can go wrong with it. And we're going to cover some of that in our next lecture on the physiology of the heart so that we can understand how to put the anatomy together with all the things that can go wrong.